How can I practice safer oral sex? Engaging in oral sex can be a pleasurable part of intimacy, but it does come with some health risks. Because it involves contact with skin, mucous membranes, and body fluids like semen, vaginal fluids, and blood, there is a chance of transmitting sexually transmitted infections. Knowing how to reduce these risks is key to maintaining your sexual health. First, it's important to understand that several STIs can be spread through oral sex. These include herpes, gonorrhea, chlamydia, syphilis, and human papillomavirus. The mouth and throat can be entry points for these infections, especially if there are small cuts, sores, or abrasions from brushing, flossing, dental work, or shaving. Even tiny cuts can allow viruses and bacteria to enter the body. Keep in mind that many people with STIs show no symptoms, so infection can happen without obvious signs. The most effective way to lower your risk is by using barrier methods every time you have oral sex. For oral sex on the penis, use a non-lubricated latex condom or a polyurethane condom if you or your partner are allergic to latex. Always check the expiration date and use water-based lubricants to prevent tearing. For oral contact with the vulva or anus, dental dams are a great option. These are small sheets of latex that act as a barrier between your mouth and your partner's genitals or anus. You can also cut open a condom to make a square barrier or use plastic wrap, like saran wrap, which is inexpensive and covers larger areas. Just be careful to avoid tearing it with your nails. Good oral hygiene is also important. Brush and floss regularly to keep your mouth healthy, but avoid doing these right before oral sex, as bleeding gums can increase infection risk. Rinse your mouth with water before and after oral sex to reduce bacteria. If you have symptoms like sores, blisters, or rashes in your mouth or around your genitals, it's best to postpone oral sex until you see a healthcare provider. Cold sores or oral infections can be contagious and may be mistaken for other issues. Communication with your partner is essential. Talk openly about your sexual history, STI testing, and current health status. Regular testing for STIs is recommended, especially if you have multiple partners. If either of you has an STI, avoid oral sex until a healthcare professional confirms you are no longer infectious. Watch for signs of infection such as sores, unusual discharge, or ulcers. Certain situations should be avoided altogether. Do not have oral sex if you or your partner has active sores, lesions, or unhealed piercings in the mouth or genitals. Avoid oral sex during menstruation, as blood can carry infections. Alcohol or drug use can impair judgment and increase risky behaviors, so it's best to be sober during sexual activity. Additional protective measures include limiting sexual activity to one partner who is only with you, which reduces exposure to infections. Regularly check your own body and your partner's for any signs of infection. Exploring sexual activities that do not involve body fluids or mucous membrane contact can also lower risks. While abstinence is the most effective way to prevent STIs, if you choose to engage in oral sex, consistent use of barrier methods, regular testing, open communication, and maintaining good oral health can significantly reduce your chances of infection. Always remember to consult healthcare professionals for personalized advice and testing options to keep your sexual health safe and informed.